Welcome to ALD's newest series, ALD Career Conversations. So last year, Alpha Lambda Delta switched our tagline to taking you from first year to career. And this series looks to do that. So it looks to explore the path from first year to a career in nursing and how to get kind of where you want to be. So we're grateful for our alumni like Mikayla that are here today. And we're really thrilled to have so many students on the call today as well. So we'll start with some introductions. Tonight, facilitating with me will be one of our professional members at large, Carlia. So Carlia, do you want to introduce yourself?
Sure. Welcome, everyone. We're glad you're here, and it's thrilled to see Mikayla again. I am the Alpha Lambda Delta advisor at Saint Anselm College in Manchester, New Hampshire, and worked with Mikayla and her co-founder as they founded our chapter, and I'll leave that up to her to tell you a little bit more about that. But I am the Associate Dean of Students at Saint Anselm, and that's a little bit about me.
Awesome. And I'm Trish Maxwell. I'm the Director of Communication at the National Office of Alpha Lambda Delta. And today we have Mikayla St. Pierre. So Mikayla was inducted, like Carlia said, into ALD in 2016 at Saint Anselm College. She majored in nursing and currently is a post-anesthesia care registered nurse at the Southern New Hampshire Medical Center. So hi, Mikayla. We're going to start with a couple of icebreakers just to kind of jump in. So if you could only eat one meal for the rest of your life, what would it be?
So I had to think a lot about what this would be because I am a huge foodie, but I think what it would be is probably chicken piccata, which is probably a really weird one to say, but I actually used to go to a lot of different restaurants and just try chicken piccata and see which one was the best. And so that's probably one of my favorite meals ever.
Waiting here to see if she missed something from the St. A's like coffee shop, like buffalo chicken or something like that.
The buffalo chicken calzones were so good. I do miss those.
Anyway, here's another one for you, Mikayla. If you won an all expenses paid 7-day vacation and COVID magically disappeared, which someday it will soon, where would you go?
That's definitely a no-brainer. I've always wanted to go to Greece. Although I don't really look it, I definitely hold more of my French authenticity. I'm like 1/4% Greek, and I love Greek food. I've always really wanted to go to Greece and check out Santorini and the islands. So hopefully someday that's in my bucket list to go there.
That's beautiful. And what did you want to be when you were younger? Did you always want to be a nurse, or was there something else?
So when I was much younger, so like early elementary school, I actually wanted to be a teacher. And a lot of my love for nursing too has a lot of those like educational roots where I love educating people about health and how to better themselves in a healthy way. And maybe someday I'll do nursing in that sort of degree where I'm an educator of either nursing or again as with health in mind. But it wasn't really until I think I was in 6th or 7th grade that I wanted to be a nurse, and I never looked back.
So now on to our real questions, right? All about the nursing and Alpha Lambda Delta. So let's go back. I'd like to know, and if you would share with everybody, what role did Alpha Lambda Delta play in your undergraduate experience? And as I earlier mentioned, you were a co-founder of this chapter. So you were really involved with the chapter throughout the whole time, but why did you join, and what inspired you to join? And then what role did it play in your undergraduate experience?
So as you know, I've been part of Alpha Lambda Delta since I believe it was my 2nd semester freshman year. So it had a huge impact on me because I really was with it for most of the 4 years that I was at Saint Anselm College. And a lot of the reason I joined is that I liked the idea of being part of a group of people who had value for just like achieving higher standards and just being in an honor society, that was something that was important to me. And I really liked, I wanted to take the initiative of being one of the co-founders and being the president with Ashley sophomore year, and then the junior and senior advisors for the subsequent years, to really foster those leadership skills and even just my confidence in myself. Prior to coming to St. A's, when I was in high school and much younger, I was very shy, and it was hard for me to really speak up and be a leader. So I took the opportunity with Alpha Lambda Delta to really foster those skills, which have really helped me even in my, of course they would have helped me in my adult years and in nursing. So it's really helped me to achieve what I wanted in my career.
Thank you.
So we've heard about how, Alpha Lambda Delta helped prepare you in your career. How did your major and some of your academic experiences help prepare you for your career in nursing? So that could be, obviously, you're a nursing major, you became a nurse, but were there specific classes or focus points or anything like that?
So definitely, I went to St. A's because I knew it had a good reputation as a good nursing school, and I was like, I'm going to get the best education here. But I definitely did a little bit more than I thought that I was going to do. So even in my junior year, I had done a research internship up with Dartmouth-Hitchcock Medical Center to do research up in their facility, which was something I never thought I was going to do as an undergrad, especially as a nurse. It seems something that really biology and medical fields, people going into that track were more going to do, and not someone who was a nurse. So that was a great opportunity that I was able to have. But also in my senior year, so we always do a senior practicum. So the second semester of senior year, you do this experience with one other nurse where you're in an area, do 200 plus hours in an area, and that actually was post anesthesia care. So it really ended up kind of directing me to where I am now and how I did the first couple of years after college. It really was a kind of eye-opening area where it wasn't 100% what I thought I was going to do, but it did help lead me to the path where I am now, is having that experience before.
Great. You've already started to describe this a little bit, Mikayla, about your path from your first year of college to your first year in your job, and you talked a little bit about this research and whatnot. What do you think is the best way to learn about your major as you're going from your first year of college into your first year of your job?
So I guess specifically too with nursing, you don't start right into the nursing classes. You obviously are learning about sciences, but they do show you this little picture of all these different areas. One of the little memories that I remember from being at St. A's is in my first nursing class, they asked everybody, all right, what kind of nurse do you want to be? Like, do you all want to be pediatric nurses? And everyone kind of raised their hand. Yeah, I want to be a pediatric nurse. But what was kind of nice is with especially my major is it shows you a snapshot of all these different options. Like, okay, this is what medical surgical nursing is like. This is what pediatric nursing is like. This is what maternity and labor and delivery is like. In a lot of the different areas, we did community, we did in the hospital, we did school nursing, and so really taking the time to really have an open mind and looking at all of these different areas and taking in all that information, which is a lot of information, but taking it all in and being like, okay, can I see myself doing this, and taking the time to just study and learn, and is this something that I want to do for just even to try it and see if it's what I'm meant to be doing in nursing, is how I always looked at it.
Mm-hmm. I'm curious as to how did you get to that research experience at Dartmouth to where you are now?
So I'm trying to think of how I know that it was mentioned to me. Actually, it wasn't even Dartmouth that was mentioned to me. There was another one with Wentworth Douglas Hospital, which is, I believe, up in Dover, New Hampshire. And I had spoken to a nursing student who had done it before, and she told me all about it. And I was like, wow, this seems like a great experience. I don't know if research is what I'm interested in, but maybe I'll apply to it. And I believe we might have just gotten an email, and I had heard about the one from Dartmouth. So I forgot about the first one and applied straight for the Dartmouth one. And I had a whole interview process with them. And you had to come up with a couple of different research projects. So for me personally, it was like finding, okay, what are things that I'm interested in that I would like to research? And it ended up being, my sister has a phobia of needles. And so I was like, well, that's something, like, can we work to help pediatric patients to have less of a fear of venipunctures and any injections like that? And they were like, oh, we have someone who was doing a research project with that. So that it was a lot of like similar interests that ended up getting me in that, and just pushing and talking about my own interest in nursing and what I'd be interested in researching that got me into that. Unfortunately, I mean, I don't know if maybe in the future it'd be something I'm more interested in. I like being with my patients more than I like just doing a lot of the behind the scenes work of research nursing. So that ended up not being its area for me, but it was one thing I could check off the list where I was like, okay, I tried this. It really wasn't for me right now, maybe in the future, but I know it's not really what I want to go into right after graduating. So it was a good opportunity to learn, is this for me? And it wasn't.
Yeah. Excellent. Thank you.
Yeah.
So I have a lot of nurses in my family, and I swear every one of them has taken a different pathway with regards to like education and certifications. So, are there certificates or any like certifications you have to maintain as a nurse? Is there a kind of advanced training you need once you get your RN? What does that look like in your field?
So it's so individual, obviously, depending on what area you're in. In my specific area, I went into it, I just had, obviously I have my BSN, but BLS, basic life support I had going into it. But within 6 months of being there, I did have to get advanced cardiac life support, just because we're working with people who are on telemetry monitors. You need to be able to quickly read a heart rhythm and know, okay, this is normal, or okay, this is not normal, and what do you do to correct that. The one that I'm still waiting, hopefully for the end of this winter, to get is PALS, which is like the pediatric version of the ACLS. And then those are maintained every 2 years. So those are two that I will have under my belt. But in my area, in pre-op and PACU nursing, they have two separate certifications that you can get that you would be certified in as a pre-op nurse and a PACU nurse, which is just a higher designation. And eventually I would love to get that too, to have that under my belt, but I haven't been in the areas long enough to actually test and do that yet. So hopefully I can keep reading up on all ASPEN guidelines and eventually get that certification too.
And where do you do those certifications? So are they through like colleges and universities? Are they through medical centers, the state?
I believe it's through, so I think most of them are like you sign up online and you do it separate. I mean, the ACLS and the PALS you can do within a hospital. But I believe those certifications are just under ASPAN, as they're like, these are the certification exams that you can take. I might be at a separate location. I'm not entirely sure myself, since I've only been in it for a little bit less than a year. So I was like, well, it'll still be another year before I can take it. So, but aside from those, I mean, as I've said before, I love how if you keep your mind open, there are a lot of different opportunities in nursing. So someday graduate school might be in the future. I mean, there's so many things that you can do. In my area, I mean, nurse anesthetist is always a possibility, but then even just as an advanced practitioner services where you're checking in patients, or there's so many options.
So I know you're going to say every day is different, but what beyond that, how would you describe your typical day? So like when you go to work, what does that look like?
So the typical day, there's two kinds, for me at least, two different types of typical days. So working in post anesthesia, you actually do both the pre-op or you do the PACU side. So if I do pre-op, that's a lot of that is rooming patients, getting the consents all done, being like an intermediary with the anesthesia docs and the surgeons, making sure everybody's there, of course, for the right reasons. putting the IV in for the patient, which I never put an IV in prior to this job. And since I started putting IVs in, I swear all I do is stare at people's veins. It's the grossest thing ever, but I find so much fascination in putting IVs in. But again, most of that is just getting all the patients ready and shipping them off into the OR. So those are certainly they're stressful for different reasons, because it's a very like hurry up until it's a slow down type thing when things are behind. But for the most part, it's not super stressful in a critical sense versus when I'm in PACU. And when I'm in PACU, then you're getting patients that are coming out from anesthesia. So you have a lot of different things that you're paying attention to. I mean, I can come in and depending on the day, I could wait 30 minutes and not have a patient just because of how the surgeries are running. Or you can have an inundation of all these patients coming in and you're like, okay, we have to make sure this one is stable before I take this person. And then you have to consider all the different levels of the surgery, where you can have the big belly surgeries that they might need PCA to help manage their pain. You could have this one had a spinal and you can barely sit him up even part way before he gets a headache. Or you have a urology patient who's ready to go home and just needs to urinate, and then he's all set. So there's a very wide range in my area of kinds of different stability levels and critical nature, which I like. I like the variance in what I'm doing. I like that as much as it can be scary, I like having patients sometimes when they come out and their blood pressure is like 80/50 and you're like, that's too low. Let's do this, or let's call anesthesia, or let's do this action to make that better. Or sometimes show someone come out of anesthesia really talkative, and I never know what to expect when they walk out of the OR doors with my patient in a stretcher, and I'm like, well, I wonder what this adventure is going to be, because it's always something very different.
What is one thing you wish you had done as an undergrad student that might have better positioned you in your field?
I think one of the main things that I would do maybe a little bit differently is I probably would network a little bit better, at least in regards to my own fields. As someone who is chatty as I am, and I love being around people, I do consider myself more of an introvert, and I'm definitely more of an independent learner, and never was one to go into professors' office hours. I never went to any of the big study sessions because I never really felt like I needed it. But I think it would have been beneficial for me to connect more with my professors, if for no other reason, just to have a network of people that could I could have gone to after graduating. I mean, certainly there's no lack of shortage for jobs for nurses, and you can definitely do it yourself, but it's nice to have a network of people that you know you can rely on, that you can go back to and say, Professor Welch, like, what have you seen in the career fields? Or if I knew of somebody that worked, I know of a couple of professors that work at Southern New Hampshire Medical Center, but I haven't reached out to them because I haven't talked to them in a couple of years. So it would have been nice, I think, to have those relationships, just to have been able to branch out and have more people in my circle of nurses.
Yeah, I think you see a lot of people say that. I don't think it's just you.
Yeah.
So what would you say is your favorite thing about your career?
I truly, and as I love post anesthesia care a lot, but I love that there's so much you can do with nursing. And I say that with obviously helping people is one of the things that got me into nursing, and I love that about my field. But as a personal thing for me that I needed, I loved that there's so many options with nursing. I mean, you can do anything, and I don't know if post anesthesia care is really for me, or what I'm going to do for the rest of my life. It probably won't, honestly, and I'm okay with that, because I know that there are so many other things I can do. There's schedules to fit anyone's life. If you're a night person, there's nights. If you like obviously being awake during the day like I do, there's days. But then you can have the Monday through Friday shift. You can do Baylor weekends and just do Friday through Sunday. There's so much that you can just do with it, and so many different areas you can get yourself in that you don't even think of. You can be a nurse in a hospital or outpatient, or even with like health insurance companies, they have nurses. You can do law as a nurse. There's so many different things with it, and I've always been a person that I like my options. So I love that about nursing.
There is. There's definitely so many things you can do as a nurse. Thank you, Mikayla. Bringing it back to Alpha Lambda Delta and kind of our audience with us today, in your opinion, how can members use Alpha Lambda Delta to get ahead in their career?
So I think I might be a little bit biased as somebody who is in the council, but I would always push to do whatever you can to be, if you can, one of the leadership positions. I think it helped me so much grow as a person and really develop those confidence skills and leadership skills that I have now, that I really feel so comfortable in things that I do. And I feel a lot more confident from being in the positions that I did. But even if it's not a president position or a committee leader position, even if you're just somebody who's in a committee and you have an idea in mind of a project you'd love to do, if you be a project manager and you really advocate for, I want to do this, I think this would be a great thing for our chapter. I think it's a great thing to learn those skills, because there's a lot of ways that you can build leadership skills, but I think that's one of the best ways to really feel like you're part of a group of like-minded people and can have the initiative to start things like that. So that's definitely.
I think that's so important too, because I think sometimes we get stuck on leadership being a position, but it's not. It's about what you do. So you don't have to be the president. You can be involved in a project or even just be an active member. I know I'm glad you said that. That's a really good distinction.
I think one
yeah.
thing that's also really neat, Trish, since Mikayla has been a part of Alpha Lambda Delta, so much has grown at the national level in terms of what is offered to its members, like these career conversations, for example, fairly new. So even that networking at a national level, I think, is really just excellent opportunities for our members.
So the last question I have for you, Mikayla, is what advice do you have for students pursuing a career in nursing?
So definitely, I have like two little phrases that are my big advice is keep an open mind and don't give up. So I know when I was in nursing, it felt like crushing, how much work and all the information, and you're like, oh my God, this is overwhelming. What am I gonna do? I'm not gonna remember all of this. I will tell you that I went into every test scared out of my mind. I left every test thinking I failed. And the one time that I felt more confident in than I ever had before, the one test that I felt that confident in was when I took the NCLEX. I went in, and for context, I believe the NCLEX is 250 questions, but it clocks out when you have hit enough where it can determine that you have passed or you have failed, and the minimum number is 75. It clocked me out at 82, and I paused for a second, and I was like, oh, I think I passed. I feel pretty good about this. And the next day I found out that I had my RN, and I was like, yes, this is great. But they really do make sure that you are so prepared, even though while you're in nursing school, you feel like you don't know anything. And it really, don't be afraid of, it's a lot. It is a lot of information, but you will be very thankful for everything that they taught you. They know their stuff and they know what they're doing. But keeping an open mind, again, going back to what I said about when the professor asked if we all wanted to be pediatric nurses and we all raised our hands, keep an open mind. Like I said, a lot of options in nursing. It doesn't have to be you go into med surg and you're there forever. There's a lot of things that you can branch off to. Once you get those fundamental critical thinking skills and you really have just the basics down, you can do anything with it. The world is truly your oyster, and you can do anything with nursing. So keep an open mind. Maybe pediatric nursing is for you, but maybe you're actually meant to be a nurse practitioner working in a family practice office, or being in post anesthesia care, or maybe labor and delivery and you see moms and babies all day. So keep an open mind.
So students, if you have any questions, you can either turn your cameras on or just your microphone and ask them, or type them in the chat and we can relay them over to Mikayla. But here's your chance to kind of ask what's on your mind.
I'm Mikayla.
Hello.
I'm not a student, but I thought I would ask a question. One of the things I want to know is how do we get more students interested in PACU nursing? Because it's not an area that you necessarily spend any amount of time in. Maybe if you were lucky, you got to follow a patient through and spend some time in the PACU. But particularly for preceptorships, it's a great area because you did yours there, but not a lot of people choose that. How would we make that more attractive to students?
That's a great question. So I know at least the way that it was portrayed to me when I was still a student at Saint Anselm College, they have very few openings for nursing students just because of the nature of it being so fast paced.
Mm-hmm.
So I don't know if that would take some conversation even with the different faculty. I know that we have some faculty, at least at my place, that are also professors and are very happy to have students come in the area. But I don't know if it even in the med surge, I'm trying to think of what would be a good area to even introduce that, because it is such it can be an ICU level critical, but it also is very much related to the surgical nursing. So in one of those areas would almost be very helpful to incorporate a little bit of information about anesthesia, just in some degree, especially with med-surg nurses taking those patients after they've been in surgery and having an understanding of the effects that anesthesia plays on the patient too. I mean, although they're down with PACU for a good hour before they come up to the floor, at least understand, okay, why is my patient feeling this sedated still, or why is he having XYZ hemodynamic instability, and maybe having that conversation about what goes on in PACU and what can potentially sometimes still be in effect come being up on the floor would be, I guess, my best guess on incorporating that more. But I took interest in it back in nursing school because I was told that it was pretty critical and fast paced, and I wanted to be at Concord Hospital, and that was enough for me. And I wanted to try something that was different.
Good. And I actually have one other question. When you mentioned not necessarily networking with the faculty, and I know we spend a lot of time talking to students about, please come see us, we're here. You know, I think maybe sometimes students think if they come and see faculty, it means that you're not doing well, so you need to go and see the faculty. But is there some way we can more positively present our ability to work with students and to help and to network and to touch base with you afterwards? What things can we do to, kind of enhance that?
Absolutely. And I think like almost presenting maybe to especially junior, senior staff as almost like a luncheon where it's just time like with the faculty there, and students can kind of walk in and talk a little bit with them and pick their brains a little bit more, where it's not so much like an open office hour, but time where, okay, we'll take this hour between 12 and 1 where most students have this time off, and you can walk in and we'll have maybe like refreshments and we can just have a conversation and almost guide it more in that direction where it doesn't feel like, okay, I have office hours, come to my office and we can talk. Because coming to an office, I feel almost a little bit more like, oh, I'm going to the professor's office, there must be something wrong.
Right.
But making it more of like a conversation.
Oh, excellent idea. Of course, we can't do that right now.
I
but,
know.
When we can, I certainly will like to think about doing that. Thank you.
Yes, absolutely. Yeah, I know. COVID, hopefully someday soon.
Yes.
So Mikayla, you talked about the rigorousness of the nursing program and of the field itself. And one of the questions in the chat is, what did you do to get into the nursing program, or how did that happen?
Oh goodness. So when I had applied to St. A's, I in turn had applied to the nursing program. I don't know that to be honest, I really don't think I can remember anything specific that I had done. I had taken the SATs and I think at St. A's at the time that I was applying, it was only a requirement, I believe, if you were a nursing major to send your SAT scores. And so I had sent mine, it was like 2000, I think. And that's all I did. And I just waited to hear back, and I heard back that I was a presidential scholar in the nursing program. And I was like, that's all I needed. I'm going. So I don't remember doing anything specifically otherwise. It was mostly just studying and doing my extracurriculars in high school, and taking the SATs. So.
Right. Another question in the chat, what was most surprising to you when you transitioned from being a nursing student to being a nurse?
So that is what I will say is the one downside from having done PACU as my nurse practicum, was when I went into med-surg, and I was used to having 2 fairly critical patients alone, which I was very comfortable with. And I went to med-surg, which suddenly, as a night nurse, you can have up to 6 patients. And they weren't nearly as critical, truly, as the patients that I would sometimes take with my preceptor. But it was a little bit daunting at first to balance the, okay, I have 6 patients. How am I going to give all of my 8 o'clock meds, assess everybody, talk to the doctors when they're rounding, and do all of these different things. So I know a lot of my friends who had gone through St. A's, they did get a slightly larger assignment. I think most of them had said that they had done 3 or 4 with their preceptor, which is great. And I think that's like the best way to do it, is to learn how to take a lot of patients and prioritize time, which is a huge thing in nursing, is knowing how to prioritize best your time, and knowing, okay, I have this one who's a walkie-talkie, alert and oriented ×3. They're probably going to get discharged this morning. The doctor just has to see them, but they're doing fine. And then knowing that you have this other patient that is a full care, and you need to assess a couple different wound sites, and they arrived last night from their procedure and they're still kind of doing a little not as well as they could be. So knowing, okay, I really need to spend a lot of time with this patient and spending a little bit less time with someone who is otherwise doing well, and learning to prioritize your time most efficiently.
So what's an effective way to study? So one of the questions in the chat, they're currently struggling with pharmacology and memorizing all the medication names that they can't pronounce, that most of us can't pronounce, let's be real. So what tips do you have? What study tips?
Oh, that is a great question. My gosh, it's still, honestly, repetition is your best friend. I mean, once I became a nurse, a lot of the drugs came a lot more second nature, because you see them all the time and you get used to, okay, there's an association with this medication with this. And even with different anesthetic agents and things that are used in the operating room, there is a lot to know with that. And sometimes the anesthesia doctor will come out and they're just spitting off different names. You're like, okay, trying to keep an idea of, all right, they got this, so they must be feeling like this. And it's like, okay, got to keep all of this straight. But it's really, truly repetition and memorization, and flashcards are your friends. I used them quite a bit when I was a nursing student, and you just have to use that repetition. Don't do long study sessions. I used to do that, and it really is not that beneficial, because you end up just tired and laying in your bed like, why am I doing this? But taking 30-minute study sessions and just going through it, it's like, okay, atorvastatin, that's a statin medication that helps with cholesterol, and going very systematically through it and repeating.
What specifics did you do as an undergrad nurse that benefited you when it came to applying for jobs? So things like externships or studying abroad, being a part of ALD or another organization, kind of what set you apart?
Oh, like in so far as resume wise, what I could speak towards?
Yeah, I think so.
Okay, so I mean, definitely being able to say that I did research was a huge thing that I could speak towards. That was definitely something that a lot of them were like, oh, you did research, that's new. And it's like, okay, that was good. But a lot of places, when you're applying for your first job, what they will ask you is to tell them about difficult patient situations. And a lot of it is really geared to what you've done in your clinicals. So I could speak to a lot of different things, even as only doing PACU as a nurse practicum and still a student when I applied to this job. So when I was doing the practicum, I was told that it's going to be hard to apply as a PACU nurse because we like critical care experience, which is very understandable now being in it because of the different things that you see and need to understand, even like ventilator settings and how to work with that type of a patient, which is not anything I had any experience in because I never worked in an ICU. But I could go in and talk about, I did a quality improvement project regarding the Aldretti score. I did this to help for new employees that would be coming into Concord Hospital to understand these are things that you want to assess with patients, and knowing almost keywords that you want to say. So again, for PACU nursing, for example, saying the Aldretti score for them was like, how does she know what the Aldretti score is? Because that's the only area in the hospital that uses the Aldretti score, similar to labor and delivery. They only use the AFGAR score. So if you've done any sort of projects with that, again, I did a project with the Aldretti score, and then I did research at Dartmouth. I had a couple of different like key things that I could talk about, at least for extracurricular, that was like, oh, that's really cool. So she takes initiative to do research and quality improvement and has these leadership skills. But then also having those clinical experiences to say, I had this patient and this is what I did.
Great. And the last question that we have in the chat, and then we'll kind of wrap it up. What or how has COVID impacted you as a nurse?
So it's definitely impacted, as it has impacted every area very differently. I work mostly in elective surgeries, and we do have emergency cases where you come in for call, but most of our cases, obviously during the day, are elective. So when I started at my job, it was in peak COVID, and most of the nurses were actually on some amount of furlough because we weren't doing any elective surgery. So it's a really weird time to be learning the job when you don't have a lot of elective cases. Now, where we're at is we're doing elective cases, but we're testing everybody. So I have personally tested my fair share of patients for COVID with one test or another, which the policies are always changing, and it's just a lot of keeping up with what's the current and best practice that we should be doing. Obviously, we don't want somebody who has COVID going into a procedure where they can now be at risk for infection and much more massive problems. So it's definitely made the process a little bit slower, a little bit scarier. I mean, we wear N95s with a mask, with a face shield, sometimes with a gown, and you do what you have to do to keep your patients safe, to keep you safe also, so that you can keep doing what you need to do and taking care of people. And it's been a lot of self-care, also taking the time that you need. I mean, I work 4 days a week. So on that day off, you bet I am taking care of myself and doing things for myself, because you can't take care of anybody if you're not feeling good. So it is very important to do that, as well as making sure that we're taking best care of our patients.
Nice. Well, Mikayla, thank you
Absolutely.
so much, not only for what you do, but for sharing your experiences. And thank you to all the students that are here. Your questions were awesome. So thank you. And Carlia, thank you for co-facilitating with me today. And I hope everyone has a great night.